Mr. Isha, I will be examining your hand by putting your hand on the pillow. Is that okay with you?
Yes.
So now I'm going to inspect and touching your hand and doing some movement. So if there is any pain or discomfort, please let me know. Can you hold your hand?
Look for the sinuses, scars, deformity, misalignment, muscle wasting, prominent swelling of the upper limb and fasciculation of the muscles.
Can you turn your hand over?
Inspect for thenar and hypothenar muscle wasting for both hands and any asymmetrical findings.
Now can you lift up your hand?
We need to look for the sinuses, scars, deformity, misalignment, muscle wasting, prominent swelling of the upper limb and fasciculations of the muscles.
Try to palpate your hand, so if there is any pain, please let me know. You turn your hand over.
For temperature, check the palm by comparing both sides to see any differences between muscle and joints. For peripheral nerve examination, you need to do screening tests for peripheral nerve to screen any respective peripheral nerve distribution, any abnormalities for the respective peripheral nerve, and proceed with respective nerve examination. Ask patient to do this sign for screening tests for 3 peripheral nerves, which are median, ulnar, and radial nerve. For precision of this sign, ensure that patient's abduction and extension of thumb and metacarpophalangeal joint and flexion of interphalangeal joint of thumb to make sure that it opposes with the index finger. For radial nerve examination, it consists of 5 motor tests and 1 sensory test. Now, we would like to perform finger or thumb extension. The thumb extension is controlled by extensor pollicis longus. The extensor pollicis longus is innervated by the posterior interosseous nerve, which is a branch of radial nerve passing the forearm.
So can you turn your hand? So now I'm going to push your thumb downward, so please resist my force.
It is basically extension of the thumb, which is across the same plane of the palmar, and ask patient to resist our force. This is to ensure integrity in the posterior interosseous nerve.
Now please make your hand like this. So now I need you to extend your finger. So please extend your finger.
Finger extension is controlled by extensor digitorum, which control index, middle, and ring finger, and the extensor digiti minimi that control the little finger. Finger extension is extension of the metacarpophalangeal joints. Doctor needs to hold the thumb to ensure that only the fingers are being used. Both extensor digitorum and extensor digiti minimi are innervated by posterior interosseous nerve. If there is defect in that nerve, the finger cannot extend.
I'm going to pull your hand downwards, so please resist my force.
Wrist extension is controlled by 2 muscles, which are extensor carpi radialis longus, that is innervated by radial nerve, and extensor carpi ulnaris, which is innervated by posterior interosseous nerve.
Flex your hand. So I'm going to pull your hand downwards. Please resist my force.
Now, it is the test for function of brachioradialis. The function of brachioradialis is for flexing the elbow in mid-pronated position. Brachioradialis is innervated by main branch of radial nerve. If there is defect in main branch of radial nerve, patient would be unable to perform mid-pronated position. Test the muscle power of midpoint flex position.
I want to test your elbow extension, so please relax your upper limb. Place your elbow on my hand. Can you extend your elbow?
Elbow extension is controlled by the long head of triceps, which is innervated by the main branch of radial nerve. If there is any defect to the nerve, elbow extension cannot be done. Elbow extension is the extension of elbow joints. Make sure the patient is relaxed and ask patient to extend only the elbow. For sensory examination, radial nerve has superficial branch which innervates the dorsal surface of the lateral 3 and half digits and the associated area on the dorsum of the hand up to the interphalangeal joints. If there is any defect, there will be loss of sensation to the area.
I'm going to test the sensation of your hand by using this octopus. So please close your eyes. Can you feel this?
Yes.
Can you feel this?
Yes.
Can you feel?
Yes.
So that's all about my examination. Thank you, Mr. Chen.
Okay.
I would like to complete my examination by conducting other peripheral nerve examinations such as the ulnar and median nerve examination. I also would like to perform a full neurovascular examination of the upper limb and also check for the elbow joint. Thank you.